almost like a full medical pharmacology handbook entry. Multivitamin, comprehensive drug monograph. 1. Basic information. Generic name, multivitamin, various formulations, often multivitamin mineral combination. Drug class, dietary supplement, nutritional preparation. Brand names, examples, Centrum, 1 a day, Supradin, Pharmaton, Revicon, Neurobion, Materna, prenatal, Geritol, iron-containing, Silver, senior formula. Available forms, solid oral, tablets, coated, uncoated, effervescent, capsules, soft gels, chewable tablets, gummies, liquid oral, syrup drops, pediatric, solutions. Parenteral, rare, usually for single vitamins, e.g. B12, vitamin K injection, not broad multivitamin combos except in total parenteral nutrition, TPN settings. Number 2, definition. A multivitamin is a formulation containing multiple vitamins, with or without minerals, intended to prevent or treat micronutrient deficiencies, supplement dietary intake, and maintain normal physiological function. 3. Mechanism of action. Multivitamins do not act as a single drug, but instead, maintain normal plasma and tissue levels of essential vitamins and minerals, provide cofactors for enzymatic reactions. B vitamins equals coenzymes in carbohydrate, protein, lipid metabolism, folate B12's DNA synthesis and red blood cell formation, niacin con NADP synthesis, energy production, riboflavin GOFFAD FMN redox reactions, antioxidant functions, vitamin C, vitamin E, selenium, zinc, hormonal regulation, vitamin D, calcium homeostasis, bone health, immune modulation, structural visual function, vitamin A in retinal rhodopsin cycle, clotting and bone metabolism, vitamin K, cofactor for clotting factors 2, 7, 1, X. Minerals, iron, hemoglobin, calcium, bone, muscle contraction, magnesium, ATP reactions, zinc, enzyme activation, immunity. Number 4, uses, general and clinical, preventive. Ensure adequate intake when diet is insufficient. Therapeutic, correct subclinical or overt deficiencies. Specific situations, pregnancy and lactation, prevent neural tube defects, anemia, support fetal growth. Elderly, counter reduced absorption, poor appetite. Children, growth, development. Chronic illness, alcoholism, liver disease, dialysis patients. Malabsorption states, celiac disease, Crohn's, short bowel, bariatric surgery. Recovery, post-surgical, post-infectious states. 5 indications. Dietary deficiency or risk thereof, poor nutrition, elderly, restrictive diets. Pregnancy, lactation, prenatal vitamins with folic acid and iron. Iron deficiency risk, iron-containing formulas. Malnutrition, protein energy malnutrition, chronic illness, cachexia. Alcoholism, especially thiamine, folate, B6, B12. Medical conditions with increased requirement, burns, hyperthyroidism, chronic infections. Prophylaxis in populations at risk of endemic deficiencies. Number 6, contraindications. Absolute, hypersensitivity to any component. Relative, formulation dependent, iron-containing, hemochromatosis, hemosiderosis, hemolytic anemia. Vitamin A containing, hypervitaminosis A, pregnancy, avoid 10,000 IU day. Vitamin D containing, hypercalcemia, sarcoidosis, hyperparathyroidism. Vitamin K containing, caution with patients on anticoagulants, warfarin. Severe renal impairment, accumulation of potassium, magnesium, or phosphorus possible. Number 7, precautions before taking. Evaluate dietary intake before supplementation. Avoid duplication. Patient may already take fortified foods or single supplements. Children, risk of accidental overdose, especially with iron. Patients with kidney stones, high vitamin C and D may increase recurrence. Patients with liver disease, avoid high doses of fat-soluble vitamins. Pregnant women, avoid excess vitamin A, teratogenic. Diabetics, some liquid preparations may contain sugar. Monitor labs if on long-term therapy. Serum calcium, vitamin D, iron studies if indicated. How to use. Take orally with a glass of water. Best taken with food to reduce GI upset and enhance absorption of fat-soluble vitamins. Do not crush or chew extended-release forms. Chewables should be fully chewed before swallowing. Pediatric drops. Measure carefully with calibrated dropper. In hospital settings, parenteral multivitamins in TPN are infused under strict monitoring. 9. Dosing information. Adults general. 1 tablet capsule daily per label. Pregnancy lactation, prenatal vitamin once daily containing 400 milligrams folic acid, 27 milligram iron, 200-300 milligrams calcium, 400 to 600 IU vitamin D. Children, use pediatric formulations only, dosing by age group. Elderly, senior formulations with higher B12, vitamin D, calcium. Hospital TPN, intravenous multivitamin formulations dosed per patient requirement. Not 10. Missed dose and overdose. Missed dose, take as soon as remembered. Skip if near next dose, never double. Overdose, depends on nutrient, iron, severe toxicity in children, GI bleeding, metabolic acidosis, shock, liver failure. Vitamin A, nausea, vomiting, headache, bone pain for injury, teratogenicity. Vitamin D, hypercalcemia, nephrocalcinosis, renal failure. Niacin B3, flushing, hepatotoxicity. Vitamin B6, chronic high dose sensory neuropathy. Vitamin C, kidney stones, diarrhea at very high doses. Number 11. Stop or avoid taking if allergic reaction occurs, rash, swelling, breathing difficulty. Lab monitoring shows excess of a vitamin mineral. Patient develops unexplained new symptoms, hypercalcemia, hepatotoxicity, neuropathy. Advised by a doctor due to drug interaction or medical condition. Number 12. Side effects. Common mild, usually self-limiting. Nausea, vomiting, constipation, diarrhea, metallic taste, mild headache. Moderate, GI irritation from iron, flushing from niacin. Serious, rare, dose-dependent, hypersensitivity reaction, rash, angioedema. Hepatotoxicity, vitamin A, niacin. Neuropathy, high B6. Nephrolithiasis, vitamin C, D. Hypercalcemia, vitamin D. Iron poisoning, especially in children. Number 13. Vital information, key points. Supplements do not replace a balanced diet. Check product composition. Not all multivitamins contain the same nutrients. Fat-soluble vitamins A, D, K have risk of toxicity. Avoid combining multiple supplements unknowingly. Iron-containing formulations must be kept out of children's reach. Elderly and special populations often require targeted supplementation, e.g. B12 injections, vitamin D. Number 14. Drug interactions. Levothyroxine, absorption reduced by iron and calcium, separate by 4 hours. Antibiotics, tetracyclines, fluoroquinolones chelate with iron, calcium, magnesium, decreased absorption. Warfarin, vitamin K reduces anticoagulant effect, monitor INR. Phenytoin, phenobarbital, carbamazepine, increase vitamin D metabolism, deficiency risk. Diuretics, thiazides, risk of hypercalcemia if vitamin D present. Loop diuretics, increase loss of magnesium, potassium. Bile acid sequestrants, cholestyramine, reduce absorption of fat-soluble vitamins. Proton pump inhibitors, antacids. Long-term use reduces absorption of B12, iron, magnesium. Thank you. Have a nice day.